Ilsa is 7 and she has a condition called Williams syndrome.
JJ's 7. He was without oxygen at birth for about 30 minutes. His brain injury, which caused cerebral palsy, happened the moment he came into the world.
Following a child who needs her level of support, but also is her own person, is super challenging.
If he's without therapy for a week, it will take a month to catch up.
Those months that we were completely closed and there were no services happening inside of our building, that was really significantly challenging. All of a sudden we're asking parents to become the nurse, the PSW, the therapy team, the educational department. Knowing that UJA was launching an emergency fund for them to apply for subsidies, these are families that lost income due to the pandemic, that was a huge relief.
The moment the school had to shut down, Goldie was in our home and JJ was on Zoom. He picked up right where he left off.
We've been able to stay open since June of 2020. We stayed open through the second and third lockdown, and that was enormously beneficial to the families. And that was thanks to UJA and their foresight into creating this fund.
We couldn't afford to take a break. The school didn't miss a beat.
Pandemic or not, like these kids still have their medical needs, there's still emergency room visits, there's still really difficult meltdowns and behaviors, and it affects the entire family.
It's a sad and harsh reality that money will affect your child's future.
We have a lot of work ahead of us in acknowledging and dealing with the emotional toll that this has taken on both the parents and for the siblings at home.
If my son didn't have this school, his future would be very grim. This school has given him a love of life. This school has taught him a love of Judaism. This school is giving these children the brightest future that they can have potentially.
Her future is very bright. She's going to be able to accomplish good things. She's going to have her own life. That's the difference that we have.
No, vaccines and kids. My name is Leanne Matlow, and I am UJA's 2021 campaign co-chair, along with Craig Walters, and I am so happy that you are taking the time to join us tonight. As we saw in that short video, UJA's 2021 annual campaign, Our Rally for Recovery, has been critical in supporting places like Kayla's Children's Center provide the essential programming. We are tremendously proud of what we've been able to accomplish already so far this year. But none of our work would be possible without the dedicated support of our donors. Those who have already contributed to our annual campaign not only help our partner agencies stay open and functioning, but they also allow our hundreds of families access social services that they need if they're experiencing financial hardship due to the pandemic. And with your help, we are going to be able to provide social assistance to through various initiatives in our community to help the most vulnerable, including children, Holocaust survivors, and those struggling with mental health challenges. Our goal is to provide these services with dignity. One of the most challenging parts of the pandemic period has been feeling of loss of information or not having the right information about how to keep our families safe. And as we sit here tonight, fortunate enough to be discussing the best choices for our children with regards to vaccines, let this webinar be a reminder that even as the restrictions lift and we start to feel life go back to normal, we're still living through a critical pandemic period. And knowing that we're still in for a little bit of work ahead of us and dealing with the consequences and the scars of the pandemic for years to come, our vision at UJA is to help our community emerge stronger, safer, more united, and have a sustainable future for those who are most vulnerable. As we dive into tonight's important program with some incredible doctors that have come together to share this information, I encourage you to consider making a gift to our annual campaign as well. For any information, please check out our annual campaign website, which is at www.rallyforrecovery.ca, or reach out to any of the professionals or even myself. We're more than happy to discuss all the great things we have planned to do with the dollars that you're donating. And now I'd like to introduce a good friend of mine, Ivan Diamond, the chair of the UJA's Healthcare Division. Over to you, Ivan.
Thank you, Leanne, and welcome again, everyone. The Toronto Jewish community is incredibly fortunate to count many leading healthcare professionals as part of our community. The medical professionals you will hear from tonight have been incredibly generous in offering their time and insights into an area which you no doubt have lots of questions, something we don't take for granted, particularly during a stressful time such as this. We are incredibly grateful for the opportunity to create this space for these experts to share their advice with us so that we can all make informed choices for ourselves and our families. We at UJA are, of course, not medical experts, and we do not presume to issue medical guidance to parents on vaccination or other topics. Rather, we see our role as being that of a community convener, providing an opportunity for community members to hear directly from medical experts with expertise in this area, as we have done throughout the pandemic. Thank you to all of you who have submitted your questions beforehand. We are also offering you the opportunity to ask questions during the webinar using the Q&A function. While we will do our best to get everyone's questions answered, we cannot guarantee it. If you find yourselves with more questions following tonight's discussion, we will email around a link to book a consultation with SickKids, where you can get more individualized advice. Before we get started, we just wanted to note that Health Canada has not yet approved the vaccine for the 5 to 11 cohort, and the opinions of each of these medical professionals are only their opinions as of 7:30 tonight, November 9, 2021. With that, I'm pleased to introduce our moderator for tonight's discussion, Dr. Tali Bodler. Tali is an academic family physician and family medicine obstetrics provider at St. Michael's Hospital and the co-founder of @PandemicPregnancyGuide on Instagram, providing reliable medical information to parents and parents-to-be during the pandemic. I hand it over to you, Tali.
Thank you, Ivan. So welcome everyone, and I'm so pleased to be a part of this evening's program. You know, speaking to many parents over the last few weeks, I've been getting phone calls in my clinic or getting questions on our Instagram page. I know that many parents here are eager to get their kids vaccinated, and many have questions about the vaccine. And this is exactly why we're here having this session tonight, to really create space to review what we know so far and help answer some of these questions. So I'll be moderating the discussion this evening. And before we begin, I'd like to introduce our panel of healthcare professionals who I happen to know on a personal level, are colleagues of mine, are all parents, and are truly experts in this area. So if our panelists can come on actually and just, great. Perfect. We're missing one. Wonderful. Good. So in the middle here, at least on my screen, we have Dr. Noah Ivers. He's a family physician and clinician scientist at Women's College Hospital at the University of Toronto. We're also fortunate to have Dr. David Kaplan, Vice President of Quality at Ontario Health, also a family physician. Dr. Carly Rogenstein, who is a staff emergency physician at William Osler Health System and assistant clinical professor at McMaster University. And Dr. Julia Orkin. She's a pediatrician and the COVID-19 vaccination medical lead at SickKids Hospital. So before we begin, we're actually going to have Dr. Noah Ivers give us a presentation and just really help us set the stage and give us a nice overview of what we know so far about the COVID-19 vaccine in this particular cohort of ages 5 to 11. So take it away, Noah.
Okay, perfect. Thanks, Tali. So I want to spend not a lot of time talking to you so that we can spend most of the time this evening talking together and talking with you. But as Tali said, it might be helpful just to set the stage about what we do know already. So just a few slides I'm going to throw at you. I'll move quickly because I suspect we'll actually come back to some of this stuff, and some of it may be things you already know. So just as a starting point, I think it's really helpful to recognize that Canada's uptake of vaccines has been truly phenomenal. We're at, as of the beginning of the month, 58 million doses, somewhat more than that now. If you look at the proportion of eligible people that have gone ahead and gotten their vaccine, well above 80%, heading towards that magical 90% that we're shooting for. So that's really great. And the reason they're getting vaccinated is because unequivocally, without a shadow of a doubt, the vaccines work. They work to prevent cases. They work to prevent severe illness. What you see in the top right of your screen is, an updated graph showing the proportion of fully vaccinated people that end up in the ICU. The cases per million of unvaccinated that end up in the ICU. And so, you see this distinction between the red line and the blue line really, really clearly. There really can be no questioning now that the vaccines prevent severe illness. They're really a bit of a medical miracle. Not only that, but we've learned a lot over time about the safety of the vaccines in comparison to the risks of COVID infections. And so this figure is a little bit complicated, but basically what it's trying to show you is that in basically every single type of side effect or concerning outcome that you might think of related to the vaccine, that you might have heard of, it turns out that infection poses a greater risk. With one exception, and that is activated lymph nodes. So that's the one instance where you see very clearly that, that the blue bar is higher than the red one. And one possible instance with shingles, although it's really close to that dotted line of 1. So it's pretty minimal difference there. I'll just point people's attention to sort of the difference in the other areas, in particular, the myocarditis, which we'll talk about more, I'm sure, later. In general, getting the infection is a much worse bet for your health and safety than getting the vaccine. And it's not a small difference. All right, so what does that do with kids? Well, we're talking about kids because at this point, the pandemic, in terms of case rates, is driven by kids. They're the last group to be offered protection, so that only makes sense. What you see in this figure here is basically that over time, as schools have opened, basically, we're seeing more and more infections in the age group of children who are at school and who are unprotected by vaccines. So that's the 5 to 11 age group that we're hoping to hear about approvals for soon. And of course, you'll hear that, in the past, we talked about the original COVID infection, the original strain being quite mild, especially in children. And in fact, it's true. Our data suggests that many of the infections are mild. They look like a child who has a fever. Maybe they lose their sense of taste and smell. All in all, children can recover well from symptoms like that. And that's really reassuring. None of us want our children to get severely ill. The problem is that this is not guaranteed to be a benign illness. This is not just a cold. In the US, we've had 500 or more tragic events of children dying. Children should not die of an infection. That should basically never happen, especially not when there is an infection that can be vaccine preventable. In Canada, we have much better numbers, in large part because we've done such a better job controlling the infection. And so we don't see as much cases, nearly as much, and we don't see nearly as much death here, thank God. But we do see that some kids, unfortunately, end up with severe illness. Some kids end up in hospital. You can imagine what it's like for the family when their child ends up in hospital with COVID. And it's worth pointing out that not all of these children have some sort of risk factor or pre-existing condition. Some of these children were completely healthy. It's a little bit hard to predict, in fact. And, you know, even if they are fine and get through hospital, God willing, you know, there is the chance of so-called long COVID, that is symptoms that continue on for many, many weeks or many, many months. Just want to highlight the last point here, that the reason that's there on the slide about polio is just to say that, you know, many folks who are not keen on vaccines talk about a survival rate of COVID above 99%. And they're right, it is. You know, the question is that a reason not to vaccinate? And most people would say that, you know, there's no question that we should vaccinate against polio. And in terms of the proportion that, you know, with polio that get flaccid paralysis, it's also, you know, well less than 1%. So just putting that a little bit into context there. But besides preventing these severe illnesses, there's a lot of other reasons to vaccinate kids. And, you know, this is just one sort of infographic to try to summarize some of those. That's to say that, you know, we don't want them missing any more school than they've already missed. We don't want them spreading the infection to potentially susceptible others around them, including their boobies, their zadies. Maybe they have somebody in their class who's going through cancer treatment, or maybe there's somebody in their extended family who is, and we really rather them not spread the disease to them, even if the child themselves hopefully stays well. And of course, we want our kids feeling safe about getting back to sleepovers and getting back to activities and not thinking twice about these things, about whether if they pick up an infection, they're going to have to cancel this or cancel that. So there are obviously lots of ideas about getting back to normal that we'd all like to see happen. And vaccines hopefully would be able to help with that. So that's one of the rationales towards it. And, you know, there was a fair bit of emphasis on that with the FDA's authorization in terms of getting kids safely back to normal. They talked about the effectiveness being about 90% prevention of infection. And then they had some comments on safety that we'll talk about just a little bit here, if you'll indulge me. So just so we're all starting the same place, what the FDA reviewed for kids aged 5 to 11 was actually 2 separate trials, but in total, we're talking about 4,500 kids, about 3,000 of which got the vaccine. And the vaccine dose was 1/3 of what grown-ups would get, or older children. As I said, the effectiveness was 90%, so 90% less likely to get an infection. If you don't get an infection, you certainly can't transmit it, can you? So it's going to be helpful in that respect. And then they did some sort of back of the envelope math and sort of projected out, you know, what does that mean? 90% efficacy for reducing hospitalizations. And you can see there on the slide, it does certainly add up. Those are numbers for the States. They obviously have more kids, maybe about 10 times more than in Canada, but it's not a tiny number of hospitalizations that we can prevent over the coming months if we go ahead and vaccinate. So that was part of the argument there. There was some evidence on safety and side effects that we should talk about. Basically, it was tolerated just as it was with older children. The most common thing is a sore arm, and that's to be expected. I spent all day Saturday given God knows how many flu shots, and it's more or less the same kind of conversation. You're going to have a sore red arm. You might have a brief fever, you know, that's going to resolve after a day or two. And that's what we saw with these vaccines in kids. We did not see any severe vaccine events. Certainly during the trial, there were some unrelated events. As you see on the slide, some kids swallowed a penny, but nothing that they could blame on the vaccine as far as we can tell. So that's a bit reassuring. Just sort of add specifically, as I said, I would about myocarditis, and I'm sure we'll come back to this. They didn't observe any cases in the trial. Now, that's to be tempered with the fact that the trial was just those 3,000 kids so far. And the rate that we saw of myocarditis in adolescents, older adolescents, 12 to 15, so older kids than were in this trial, was a little less than 1 in 10,000. So we are going to need more data to see if it's a similar rate. Most commentators believe that the rate will actually be lower because we're talking about that 1/3 dose now. But time will tell about that. Just two other things I want to highlight here is that recent polls suggest that most parents do plan to vaccinate their kids in Canada, which to me is reassuring because it'll help us control the pandemic. But at the same time, I want to emphasize that it would be really normal to have questions and really strange not to. This is all new. We're all figuring this out together. And so we really, as a family doc, I want my patients bringing me their questions so we can talk it through. And just to say, there's a couple other things that we can also circle back to around, systematic ways to help kids do better when they come to get a needle. And so the healthcare professionals involved in the rollout will have sort of information about this sort of so-called card system and some ideas that they can offer children and offer children's parents and guardians about how to make it go better. And we can talk more about that as we go on as well. And then lastly, there is sort of toll-free sort of service that you can do. You can talk to folks at SickKids to get information on your particular circumstance. We probably don't want to address very specific clinical questions on this call, but know that that is available to you at SickKids day after day. There are well-trained people ready to talk to you. And there's an increasing number of resources, some of which I've shown here on these slides, and we can put those in the chat later as well. I think that's what I wanted to cover, just to level set. I'm sure there's lots more to talk about.
Great. That was really helpful, Noah. And again, I think it just sets the stage and just catches everyone up to speed and make sure we're all on the same page to start with the Q&A. But before we go through some of the questions, we'd actually like to invite Dr. Carly Rogenstein to come on. She has an interesting story to share, given that your son went through the Moderna trial. And maybe you could just share with us what that experience was like as the family and how it went for you.
Sure. Thanks so much, Telly. So hi, everyone. My name is Carly Rogenstein. I'm an emergency doctor working full-time at William Osler Health System. And I have 3 kids, a 7-year-old and 2 5-year-olds. And my 7-year-old son, Owen, was a participant in the Moderna trial. So I'm just going to share my screen right now so that you guys can see my presentation. There you go. All right. So that's my son, Owen. So we were enrolled in the trial in August, and Owen received his first study dose at the end of August. So just a little bit of info about the Moderna trial. There are over 13,000 children across 100 sites in Canada and the US, kids aged 6 months to 12 years that are participating in the trial. And there are approximately 675 kids in Canada participating in the trial. And I think about 60 kids at the site that we were seen at. So just like the Pfizer trial that Noah spoke about, it's a randomized observer blind and placebo-controlled trial. And it was divided into 3 age groups, and Owen was part of the 6 years to 11-year-old age group. Of this group, 75% of the kids got the trial vaccine and 25% of the kids got the placebo, which was saline. And there are multiple appointments over the 14-month study period, including a symptom e-diary that we have to complete for a week at various times throughout the trial. So we were given a little study cell phone where our e-diary showed up every day to be completed, and a little thermometer and a measuring tape. And we filled out these symptom surveys after the study injection was given, as well as at various predefined points in the 14-month study period. So we're still in the middle of the study. So we were recording symptoms like arm pain, fatigue, headache, redness, fever, and sort of induration at the site of the injection, which we had to measure with a little measuring tape. And we took his temperature every day. So as for consent, so Owen is only 7, but they did a really good job of explaining to Owen directly that participation in the study is completely voluntary and he's allowed to withdraw at any time if he feels uncomfortable. And Owen even signed this little consent form, which was reviewed with him in full by the study coordinator. And he was pretty proud of that. So people keep on asking me, how do you know he got the vaccine? How do you know he didn't get the placebo? And they're right, I don't really know what he's gotten yet. So part of the terms of the study were that if another COVID-19 vaccine becomes available for the child's age group during the study, and it receives emergency use approval in Canada, then we will be unblinded and we'll find out if Owen received the study vaccine or the placebo. And then at that point, we'll have the opportunity to get him vaccinated if he hasn't already received the vaccine. So there's Owen. That was after his first injection. He also had some blood work done on day 1 as well. He was symptom-free after both his injections, and he was so proud to be part of the study and contribute to scientific knowledge. It also gave him a great understanding of how studies are conducted and the opportunity to sort of learn the research process, which was super exciting. And they were very generous about giving lots of ice cream bars. So every time Owen was at the study office, we have an appointment next week, actually, he gets an ice cream bar, which he's really excited about. So thanks so much for listening. If you have any questions throughout the Q&A with regards to the vaccine trial, I'd be happy to try to answer them. And thanks so much for including me in this talk.
Thanks so much, Carly. I think it's, just so helpful to know about your experience and what it was like for your kids. So thank you for sharing that. And at this point in the evening, I'd like to invite our panelists to come back on. And we are going to go through some of the questions that were submitted in advance of this evening's session and try to go through them one by one. And if more questions come in the Q&A, feel free to send them in and we'll try to lump them with other questions and try to really get through as many questions as possible in the next 30 minutes. Okay, so I'm going to start off as Dr. Kaplan. Yeah, he's there as well. Great. Okay, so just to build a little bit on Noah's presentation, and it's very timely given that this trial in this age cohort was just published today in the New England Journal of Medicine. And there were some questions that came up specifically about the trial, wanting to know the exact numbers. And I know, Noah, you just sort of answered that, about 3,000 received the vaccine. I was wondering, Julia, if you can talk about this, because one of the questions people have sent in is this vaccine, is the trial different from other childhood vaccines? Is this number, the 300, is that lower than other trials for other vaccines? And just to give us a sense of what it's like and how do we actually do trials for kids and vaccines and treatments in general?
Sure, I'm happy to answer. And really, I'm thrilled to be here to talk about, a possible solution and a, golden light at the end of this pandemic, which we know has been so challenging for so many reasons beyond just the COVID-19 infection itself, but the challenges around learning, mental health, and for families, themselves. So I think what it's really important for people to know is that vaccine development and approval in Canada and internationally is actually a staged approach. And often what you see at the end is the final approval, distribution, and vaccination. But the pre-phase is actually what we want to talk about today in the clinical trial. And there's, as Noah alluded to, there's really 3 phases. The first phase is often just tens of volunteers. So maybe 50 people, 30 people. And there's initial questions, is the vaccine safe? What is the right dose? What is the safe dose? Are there any immediate side effects we need to know? Then you go to the next phase, phase 2. That's usually, let's say, 100 or hundreds of volunteers. Similar questions. How well does the vaccine work? What's the response? is it safer in a larger number of people? And what's the safest but also most effective dose to get that response we're looking for? And then the last phase, phase 3, which is what we heard today, combination of phase 2 and phase 3 in the New England Journal of Medicine, is really, does this vaccine work to prevent disease? And that's usually 1,000. So 3,000 or so is a very appropriate and normal number that would be used for any vaccine development. And then once that's, preclinical and clinical trial phase is complete, then you go for a scientific review. The experts come together at Health Canada and other organizations to actually make a decision about whether, when, and how to administer the vaccine in the safest and best and most effective way for our children. And they look at benefits and risks, and together make a plan for distribution and vaccine rollout.
Great. And then just one added question to that. In terms of adverse events in this trial, what did we see? Did we see any? Did we not?
Right. So I think that's, a very good question. And Noah alluded to a little bit that the most common side effects are what you would imagine that you have for any vaccine. So some people report that their arm is sore, or that they, maybe felt really tired or had a bit of a headache. Those were the most common side effects that were reported. And it's important to recognize that some of those side effects occurred in the placebo as well. So, when they injected the placebo, so not actually the COVID vaccine, people complained of similar side effects. And so really redness, swelling at the site, and pain, are quite common, headache and being tired. The more severe side effects, really no severe side effects were seen in the clinical trial. And that's really important to highlight. Once again, there's many safety mechanisms put in place in Canada to make sure that when it's rolled out, we have very rigorous methods to ensure that safety is monitored, continued, and acted upon when there is a possible adverse event. But for the study itself, even fever as a side effect, the New England Journal study reported just 7 individuals with fever in the dose 2 and less than 5 in dose 1. So really, once again, highlighting what you would even think as mildly severe, even a slight fever was barely seen. So I think, once again, to expect that sore arm, to expect feeling a little bit tired the next day. And I think many of us who got vaccinated, felt that, and, it's working maybe if you have a little bit of a feeling.
Great. Thanks, Julia. Next question is about the actual dose chosen. So the 1/3 of the adult dose. And this question is specifically, we had a few questions that have come in during the evening. What if my child's birth date is at the end of the year? Should I wait until they're 12 to get the full dose? And then also, what if they only receive 1/3 the dose this year, and then for their second dose, they're then eligible for the full dose? So I think the question really is around what's really the difference between age 11 and age 12, and should I wait? So we'll start with that question, and then there's a follow-up question to that. David, why don't you take it away?
Sure. The other thing I just before I answer that, Tali, I think is really super important about this study and the COVID vaccine trials in general is that, they're pretty representative of communities. So, a lot of research, unfortunately, doesn't necessarily reflect all populations. And if you actually look at the folks, the kids that were in this study, they weren't just, white kids from affluent neighborhoods. They really were representative of children in Europe and in the United States. And which means for our community also, they're not just, Ashkenazi Jews who may have had, descendants from Europe. And so I think it's really important for parents from really the very vast set of Jews who live in Toronto and in the GTA to understand that it is actually quite an inclusive trial, which I think is really super important. But around the dose specifically, so, with many of our pediatric vaccines, we're always having to find a cutoff, so hepatitis vaccine is very similar, which dose we give people. The hepatitis vaccine or the junior version for many of the folks who have kids who have allergies, some of the allergy medications obviously have cutoffs. But what I think is really interesting here, which really speaks to this question of like, if I have a almost 12-year-old, do I wait to get the response with the higher dose, the 30 micrograms dose versus the 10 micrograms? The comparison group in the trial actually wasn't 12-year-olds. It was 16-year-olds. And I think what's so interesting was that in those 11-year-olds that got their 1/3 dose, they had almost exactly the same immune response as the 16 to 25-year-olds who got the larger dose. And so I think it's about, just how our immune systems as children develop, as opposed to how much we weigh or some magical number. And so I think it's totally appropriate if you have a child who qualifies, if it gets approved in the next couple of weeks and your child's not turning 12 for some time, I think it makes sense to go ahead and get that dose of 10 micrograms, which is the pediatric dose in this trial.
Great, thanks. Any other thoughts about that? Any of the other panelists want to answer to that? Good, thumbs up. You answered well. Thanks, David. So
well, if Noah says I answered well, I'm doing okay. So
A+. The other question about the dose specifically was about weight. If you have like a really small child, yeah. So I already seen head shaking no, but it's a very common question. We actually had a few
Great question, right? It's a natural
and because
that we never dose vaccine by weight, right?
Yeah.
We have 2 doses of hepatitis vaccine, for instance, a junior dose and a not junior dose. And like, you get this tiny, booby who's 95 and she could get the, maybe she should get the junior dose, but we give the grown-up dose.
That's
and
right.
that's just, we do it by age. It's more a function, as David was saying, about how the immune system and the reaction to a vaccine will change with age rather than with weight.
Yeah.
Great.
But I think it's a great question, right? Because all the other medications we give children, for the most part, we dose based on their weight. Many of us have been in the doctor's office where the doctor pulls out the calculator and says, oh, wait a minute, we haven't weighed your kid in like 3 months. We better weigh them to figure out how much antibiotic to give them. So really important question, but a little different for vaccines.
Great, thank you. Okay, next question, still about doses. What about the dosing intervals? So in the trial, it was 21 days between the first and the second dose. The question specifically is that there have been studies now supporting a longer dosing interval for adults, but particularly here in Canada, we've seen that. Is the 3-week interval, as done in the trial, the best dosing interval for kids? David, do you want to take this or do you want to open it up?
I'm happy to have anybody else. I feel like I've been chatting for like the last 4 minutes. So
Julia, you want to?
Go ahead, David, and then I'll follow up.
Yeah, all I would say is, the reason that the guidance in Canada for adults we have data to talk about. The fact that the dose response is better if we wait is because we made a decision right in the spring that we were going to delay people's second doses. It wasn't the trial data. The trial data, just like this trial, was based on a 21-day interval. But we don't know that data holds true for kids. We do know that they have a very good immune response with the 21-day dose after the second dose of vaccine. But ultimately, I think, and probably everybody would agree, it's going to be up to Health Canada and NACI to really guide us around what the interval should be for kids. But this trial was based on 21 days.
Yeah, that's exactly right. And I think we will look to our guidance moving forward. And as the evidence comes in and information is provided and recommendations are put forward. So at this point in time, we know it will be 2 doses. The possibility in the future of understanding the need for boosters or certain high-risk populations who may not be able to provide the same immune response will be, forthcoming. So once again, information will be gathered in real time and disseminated appropriately with scientific review.
Great, wonderful. Another question about doses. And it's good that people are asking such nuanced questions and that's what it takes for many parents to feel comfortable with going ahead. And so that's exactly why we're doing this. One question is, what if my child already had COVID? Should they get 2 vaccines or only 1? Noah, do you want to answer this one?
I want to defer to Julia. She had a great answer when we were talking before.
Okay.
So I think the answer right now is that we don't know an individual child or adult response to the COVID-19 infection in general. We don't know what their immune body's response is. And so what we do know, though, is with 2 doses of vaccine, we can predict what your immune response should or could or most likely is. And so right now, the current guidance is that even if you unfortunately have had COVID or your child has unfortunately had COVID-19, the recommendation is still to go ahead with vaccination, that it is safe, appropriate, and that a more standard response is in that individual's best interest to ensure protection to themselves and their family and community.
Yeah, and I would only add that about 10% of the kids in the trial, just under 10%, actually had a previous known exposure to COVID. So not all the kids in the trial actually had never been exposed to COVID.
there was no difference in terms of side
Correct.
effect profile to those kids who had COVID prior to getting the vaccine versus not?
That's my understanding. The trial was published just today in the New England Journal. I think it was today, but in the New England Journal. So
Yeah. Okay, we're going to switch gears a little bit and just talk about, so many people have been sending questions. Well, when is this going to be approved? The sooner the better. Does anyone know when Health Canada is going to be giving us some more information? Noah.
I think we'll see an approval before the end of the month. I've heard that we're probably 2 weeks away. I know that the Health Canada folks are like poring over the little bits of data and asking questions when they're unsure of something and double checking things. So I know that there are folks spending a lot of time being very careful before approving, but my sense is that they're going to get there about 2 weeks from now.
Great.
I wish they could be faster. Personally, I think others wish they would take longer, 'cause knowing that they're taking all that time is reassuring. So
Thank you. And I'm going to switch it over to Carly for a little bit. And just want to ask you, while we wait for approval, because even once we get that information from NACI, it might be a bit of time until we actually get vaccines in arms potentially. Any advice for families in terms of navigating the winter months before vaccines, how to interact with boobies, zadies, as we've said, or other children in terms of, extracurricular or play dates?
This is a tough question to answer because I think everyone has their own risk tolerance associated with COVID, and also everyone's situations are different. If they're immunocompromised or high-risk people in your family, you may make different decisions with regards to who you're seeing and what you're doing. For now, personally, my kids are seeing their grandparents because grandparents are fully vaccinated. We try to use masks when we can, and we use sort of the Swiss cheese model of trying to insert certain safety protocols in our house to make sure that we feel comfortable. And obviously, if anyone has symptoms, we're not seeing grandparents at that point until a negative COVID test and symptom-free.
Any other thoughts? I'll just open it up. No, we're okay. Thanks, Carly. Okay, so I'm going to get into a little bit. We're getting lots of questions. They're great questions that are coming in. Let's talk about myocarditis. I think we haven't spoken enough about it, and there's lots of questions. And I'm going to turn this over to Julia to talk a little bit about what we know. And I know Noah spoke about a little bit in his presentation in terms of rates of hospitalizations and multi-system inflammatory syndrome in children. What can we expect in terms of myocarditis related to vaccines? What are we seeing right now in children in the 12 and up? And what can we expect from the 5 to 11?
Sure, I can start and then open it up for discussion. So for many, the word myocarditis was not, a common household topic. So, it's really something that has been put into the forefront, and it's really inflammation of the heart, or pericarditis, inflammation of sort of the sac around the heart. And most of the cases, as Noah even showed, associated with myocarditis is actually COVID-19 related infection, not necessarily vaccine related, but there was vaccine related myocarditis and pericarditis that was found, most often in young men and often after that second dose. The most important factor, though, however, is the majority of individuals who were unfortunately diagnosed with myocarditis or pericarditis did not require hospitalization and were safely treated with, non-steroidal or medication like Advil. I think for children, once again, they are overarchingly, potentially low risk from COVID-19 in and of itself. And so what we have to do here is put all those risks and benefits together. So we were able to track in Canada all children who unfortunately were infected by COVID-19. The majority also not admitted to hospital. So one of the largest studies in Canada that was published just earlier in September showed that almost 50% of those individuals who were hospitalized with COVID-19 were actually hospitalized for other reasons. So although they end up in hospital with COVID, they were incidentally found with COVID. So really the majority of children, even who do get sick from COVID, are otherwise well. So we're really talking about children who do well and very, very, very rare side effect of vaccine, and even more likely to come from COVID-19 itself. I think what really we do need to talk about from the the vaccine risk benefit is, once again, no myocarditis and pericarditis were seen in the trial. Once again, as you know, that they're just thousands of individuals, not hundreds of thousands or millions. But as they roll out in the US, there are very, very strong rigorous methods in place to make sure and to monitor for that possible side effect, and to put mitigating factors in play, and to review the evidence to ensure that it is the most safe formulation, dosing, time interval, etc., to prevent, and that everyone is aware of the signs and symptoms so that they should seek out medical health professional opinion if they are concerned that it may be affecting them. And that really would be if they're feeling chest pain or other symptoms, that could be consistent, to seek out help.
I think it's also just important to mention that myocarditis is sort of a spectrum, or myopericarditis is sort of a spectrum. There are some people who are asymptomatic or have very, very mild symptoms, and those are the majority of the vaccine-related myocarditis. Whereas when you talk about myocarditis in COVID-infected patients, personally, it's a very different story for these people. It's associated with heart function issues, as well as, often multi-system organ failure.
Yeah, just building on what Carly has said, we have really good data out of Israel showing that we might call them both myocarditis, but the vaccine associated inflammation is short-lived, and in almost all cases has resolved with basically rest and Advil. And the cases which are more often caused by COVID infection are much more severe. So again, just harkening back to what I said in the slide, it's a bad bet to get exposed from infection rather than exposed by vaccine, based on the data we know so far for older children. And of course, we're going to keep watching the data for younger children, because we haven't seen any signal either way, really, in younger children.
And the other thing to keep in mind, and there is some thought about this, that it is 1/3 the dose that we gave in older kids too. And so there is a thought that maybe there is less risk of myocarditis with a lower dose as well.
Hopefully.
Which is exactly why we've not recommended Moderna anymore for younger adults, because of the higher dose in Moderna over Pfizer. So biologically, it makes a plausible sense to do that.
Yeah, most of the vaccine-associated myocarditis in Canada was males getting Moderna who were around 20 years old after their second dose. So that's getting a high dose of mRNA. It's like 100 micrograms versus now we're talking about younger people getting 10 micrograms. So it is a big difference.
Yeah.
Just on the same note with the exposure tally, I wonder if we could maybe just talk a little bit about the risks of developing long COVID from even if a child does sort of not need to be hospitalized, or God forbid need the ICU. We know that a lot of adults who don't get hospitalized, who don't need the ICU, tens of thousands are suffering. Not everybody needs some sort of intervention or rehab, but they do suffer with symptoms that persist 4 months after infection with COVID. And, the top 4 are really, shortness of breath, sleep difficulties, anxiety and depression, and fatigue and pain. And I don't think any of us would want we're all parents, all the physicians in the panel. I don't think any of us would want to expose our kids to that possibility. And unfortunately, we know what the percentage is roughly in adults who get COVID, but we don't really have a good sense of how many kids suffer from this, probably because most of them can't tell us. But given the burden in adults, I think you could argue that there's probably a good burden of long COVID in children as well.
Great. Just as we're talking about symptoms in general, somebody asked, what are the symptoms that I should watch out for my kid for myocarditis? Maybe Carly, maybe you can answer that one actually.
Sure. I would say that most kids or young adults that I've seen with myocarditis come in with chest pain or shortness of breath, often worse lying flat. And it's important that if you have these symptoms to seek emergency medical care at that point.
Great. Okay. So switching gears, I know we're a little bit all over the place, but really we're just trying to do a rapid fire and answer to get as many questions in as possible and answer them. Will the vaccine prevent transmission? That was one of the questions that have come in. We'll start with that one, and then I have a few other ones related to that. Noah, do you want to answer that about transmission?
Yeah, sorry, I was just trying to type as many as we could before we ran out of time.
You know what I will say? I think the Q&A will be open even after we finish, and as we're closing, we can try to, all of us will go on and try to answer as many questions as
yeah,
possible.
so in terms of transmission, I think early on, if you go back when we were starting the rollout, we were very hesitant to say, does the vaccine reduce transmission? We need more data, we need to understand. I think now we can say with a great deal of certainty that it reduces transmission. And just intuitively, if we reduce infections by 90%, if you're not infected, you cannot transmit. So just by that alone, we're going to reduce transmission a great deal. But then we know from what we've seen in other sort of older people who have gotten so-called breakthrough infections, those infections tend to be more mild, not as an absolute rule, but tend to be, and tend to have lower viral load, which means less transmission as well. So there's multiple mechanisms through which the vaccines reduce transmission. But the big one is if you don't get infected, you can't pass it on. And that's how we stop the pandemic.
Great, thank you. And then just to add to that, how long will, sorry, I was just reading a different question that just came in. It's a little bit different. That's helpful for transmission. And I just want to add to that, even though the study didn't actually look at transmission, we can extrapolate from the older populations, what we've seen in real world data. So in terms of immunity, people have asked us, how long, are we going to have to give boosters for our kids? How long will immunity last? Somebody even asked, like, if we're giving 1/3 the dose, does that mean 1/3 less immunity, or will it not last as long? So David, do you want to answer that question?
Sure. Yeah. So, it sort of doesn't work that way with immunology. So, giving somebody 1/3 the dose doesn't mean that they're going to get sort of 1/3 as much protection. And that's why in the phase 1 studies in children, what they really wanted to do was look at if we give them 10 micrograms or 20 micrograms or 30 micrograms, do they get the same immune response? Does their antibodies levels go up as high? And which is exactly what they saw, right? That the kiddies who got 10 micrograms had a very similar antibody response to the 16-year-olds who got the quote unquote adult dose or the over 12 dose. So I think we don't know the answer for, how long the protection is going to last. We do know, because Pfizer's told us, that they are going to continue to follow these children for 2 years. And originally with the chickenpox vaccine that most of our children, I would probably say almost all of our children have got, we only thought it was 1 dose. My eldest is 19. She got her first dose. We never thought we were going to have to give her another dose. And then based on the data, this large cohort of, I believe, Japanese children that they had followed in a Japanese study every year looking at their immune response, it was decided that we were going to boost children. And so she got her booster much later. But my son, who's just 2.5 years younger than her, got both doses at whatever scheduled time that they would have got it in 2005, 2006. So I think we're going to follow these kids along and look at the data and decide if we need to boost them. As you saw this morning, Health Canada decided that they approved a booster, but only for over age 18. They didn't decide that they were going to approve it for over the age 12. So I think we have to look at data and follow the data.
Okay, great. Another question just to add to that is somebody sent in, but what about the fact that this vaccine is for the wild type COVID-19? It's not against the Delta variant of concern. Would we expect a new vaccine to be required in the next year that's more targeted towards variants of concern? Noah, do you want to answer this one?
Sure. So I think there's a 2-part answer to that question. It's actually a really, really interesting question. First, this trial was done at a time and in a place where the Delta variant was predominant. So we have 90% efficacy against Delta variant for kids aged 5 to 11. We can say that with some confidence. The question about whether in future we'll see updated versions of the mRNA vaccines, I think probably the answer is yes. I know that the labs are working on that. Whether we need that to fight Delta, the current evidence is no, we probably don't. So, you know, two-part answer.
Can I add something to add is that, you know, vaccines are only one layer of protection. And I know everyone likely knows that, but I think it's really important to add that every single thing that you're already doing to keep your children safe to continue. So wearing a mask, maintaining physical distance when appropriate, limiting contact, self-screening and keeping your child home when they're sick from school. All those factors are in addition to vaccination. It's not that suddenly we get vaccinated and then all of that goes out the window. It's really a partnership. And so I think that's, yes, we'll get the vaccine, but in addition, everything else is needed until we understand. And as children will get one dose and then potentially a second in time, those other measures are really important in the interim as well.
And that's great, Julia, that you actually mentioned that, because one of the questions that came in is, well, so we get vaccines, will that actually allow us to go back to normal? Will we be able to stop cohorting? Will we be able to, you know, live our normal lives again?
I think that's a really, it's, you know, the $1 million question. Right now, we're still in the pandemic phase, and there will be a time when it becomes more endemic, where we are living with COVID-19 like we live with influenza, where it's still a significant cause of morbidity and mortality, unfortunately, for individuals, but that we have ways to prevent and that we know how to limit spread. We're still in, you know, a time of critical importance. The fourth wave, you know, for children, we were very nervous. We did a lot of health system planning around possible, you know, major hospitalization for children, both with regular viral illness, influenza, COVID-19, and we didn't see that thanks to really what each and every one of you do every single day. So I think we have to remember that, you know, we're in it for the long game here, and it's really hard. But children started school in September, they're still in school, and it's, you know, going well by and large, recognizing there have been outbreaks, unfortunately, in schools. But I can say, you know, we've had our, you know, very, very, very low hospitalization amongst COVID in children, despite the number of outbreaks we've seen.
Great, thank you. I want to address one of the questions that I personally get all the time, especially as I talk a lot about vaccines and pregnancy. One of the questions I always get from patients are, but what about the long-term effects? Like, how do I know this vaccine is not going to have any long-term issues for my child if I get it while pregnant, or just for my children in general? And so I'm curious, you know, from the panel, how do you answer that question? Because it's a great question, and it's one that it's quite common. Noah, do you want to start us off? I know I actually spoke to Noah about this quite early on in the pandemic, and you gave me such wise words that I use with my patients as well.
I was typing, so I have to shift it to David.
You don't want to answer this question, the long term?
Rephrase.
Okay. How do you answer the question about what are the long-term effects, like that it hasn't, you know, hasn't been studied long enough, and how do I know this is not going to have an impact on my child long term?
Yeah. So it is true that the vaccines have only just been rolled out. What is also true is that the virus is brand new. And I think, you know, we have 100 years of research on vaccines in general to draw on about how they work and what happens with them. And we have actually, you know, a couple decades or so of research about how mRNA vaccines work, although these specific ones are new. And so we know a lot about what happens when the vaccine goes in your body and how quickly it's broken down, and then it's gone, and all that's left is your immune response. We know relatively less about what happens, you know, 6 months from now or 10 years from now when you've been infected with COVID. You know, we've just seen data coming out of England showing that by eliminating HPV, we've eliminated cervical cancer. It's incredible. We've actually, like, talk about a medical miracle. We've eliminated cervical cancer. Like, that's just mind blowing. So personally, I'm a lot more scared of COVID than I am of the COVID vaccine and the uncertainties that COVID could hold in the long run. I mean, still, you know, we live our lives. I see my patients, my kids are playing hockey and so on, but like, you know, that worries me more given what I do know about vaccines and don't know about COVID.
Yeah.
David, you have something?
Yeah, I just totally agree with Noah on the way that you know, he answered that question. And you know, having many of us have not known somebody who has been affected by a vaccine preventable illness, but I can tell you that my uncle in Israel had had polio in the early 1950s before there was a vaccine. And I have a number of patients in my practice who actually suffer from post-polio syndrome, who are older, and we just don't, we're not used to seeing people affected by vaccine preventable illness in Canada or in North America. And like Noah said, like I'm more worried about the long-term effects of the virus. I think it's important just, to level set around, because we get this question a lot about mRNA vaccines. We don't have the tools in our cells to reincorporate that genetic material into our DNA. It is physiologically impossible. And I think people are worried that it's sort of a genetic vaccine. And I think one of the takeaways from tonight is that we just don't have we don't have the mechanism in our cells to incorporate this genetic material back into our cells. And within days, the material that we inject and the spike proteins that our cells produce because of the mRNA vaccine are no longer in our body. It's not like taking a medication day after day.
Any other thoughts? Just one question that I often get because I, practice obstetrics and have quite a young practice is this question about menstrual cycles. David, I'm happy for you to take it, and I can add as well.
Go ahead. I stopped delivering babies almost 3 years ago. So.
Well, and it's a great question. It's one, there were anecdotal reports that were surfacing online, lots of them. And there's some surveillance systems specifically out of the UK that does track this. Unfortunately, in Canada, we don't track menstrual cycle changes, so we don't actually have good evidence. We don't know that there's a link between the vaccine and menstrual cycles. Hypothetically, potentially there is, given these anecdotal reports, but we still don't know if there's any link whatsoever. And what we've thought that if there is a link, potentially it has to do with sort of our immune system, sort of acting, revving up after the vaccine, doing what it should do. And the uterus is actually, like the endometrial line is actually part of our immune system. So perhaps if there's some changes, it's just the inflammatory immune system working after the vaccine, and it's short-lived. Like it would happen for the first cycle or the second cycle and then would go back to normal. Has absolutely no link with future fertility. Also a myth that was spread online during the early months of the, with the vaccine rollout. It's actually not true whatsoever. We have really good studies, a lot of them out of Israel, that have shown absolutely no impact on fertility, no impact on egg quality, no impact on implantation, and no impact on pregnancy rates when they actually looked at couples undergoing IVF. So that myth has been totally debunked. And I think it's important to remember that your kids who are getting the vaccine in that pubescent, puberty time period, their menstrual cycles are already a little bit irregular. So you might actually not notice anything because many of those young girls are not getting bang on regular cycles to begin with. So if there's a little bit of a change, you probably wouldn't notice anything at all. If anything, you probably won't really notice unless they have regular cycles. Maybe for the first 2 cycles after the vaccine, maybe there'll be a little bit of a delay or a little bit heavier, but that's about it and should go back to normal.
There was a question about just the specifics around diversity. So I posted some of the statistics about the study in the chat about the diverse kids in the study.
I think one question that it would be really nice to answer is just where should parents expect to get the vaccine? Like, is it going to be in the school system? Is it going to be at their doctor's office? What are we hearing? I know, Julia, you're part of, some of, and David as well, how this is actually going to look specifically here in Toronto.
So I can start and David can add. So I know the City of Toronto will be releasing some information in the coming days, and really we do have to wait for a formal approval. And once there is approval by NACI, the recommendation, the time interval, et cetera, will be shared. The primary focus though really will be what you've seen before. So there'll be opportunities for mass immunization clinics that will be run through Toronto Public Health. There'll be opportunities through the school system. The initial prioritization for school-based clinics will be done through public health, looking at highest risk areas, basing on a variety of different factors, including current vaccination uptake for that neighborhood, their COVID risk factors, and other sociodemographic risk factors. And then there'll be opportunity through pharmacy and primary care. And really, it's about you figuring out with your child what is the most appropriate setting. There'll be specialized opportunities for children with medical needs and accommodations, for children with behavioral or those who need more of a lower stimulation opportunity. Sick Kids and many other hospitals will be offering that, as well as strategies for those who have really severe anxiety or phobia around needles, which we do know is a real factor. So a lot of information will be coming, but there's lots of great ways that you can work with your child in preparation. And Carly alluded to it a little bit, but preparing them, talking about it, talking about the benefits of it, preparing them appropriately for the small risk that it might hurt, and being honest about that, but then giving them treats and feeling proud at the end. You can see that. You could see that on Carly's son's face. So I think that's what we can do in the next 2 weeks as we wait to hear.
David, anything else to add?
No, I think the one thing I would tell folks is that I think unprecedentedly, Toronto has actually surveyed 42,000 people around where they would like their kids to get vaccinated. And I think a lot of that data is going to speak to the plan. I think we'll hear a bit more about the plan in the coming days. All of the public health units actually have to have their plan approved by the government. So it's not that the plans aren't in place. It's just that the plans are actually being approved, and there's 34 different public health units, and they are being approved by the government. I do think it's very telling that in one study that we did see the information about the first choice that parents wanted their kids to have their vaccine was at their pediatrician or at their family doctor's office. We know that wasn't a huge option for COVID vaccination, but pretty close behind actually was a mass vaccination site or pharmacy. And so I think that's pretty good to see that most people were pretty comfortable with those and really liked the experience. I think we heard a lot of positive experiences about the mass vaccination clinics, even for people as young as 12. So.
Yeah, and I can add that right now the mass vaccination sites are working to make it child friendly. So we're looking at expertise and what specialized services and what stickers and other distraction methods can be available so that it's as child friendly as possible.
No, we're not going to have Big Bird. No. Okay. I think, surprisingly, we actually got through most of the questions. There's a few Q&As that will stay on and try to answer as many as possible, but we actually answered all the questions that were submitted ahead of the evening tonight. So well done, team. I just want to say thank you to all of you for coming on and really just for sharing your expertise and sharing your evening with us. Really, I could just chat with you all evening long and listen to what you have to say to so many of these common questions. I think these questions are common, and there's a reason for that. We all want to feel comfortable vaccinating our kids, and we just need, answers to these very common questions. And I think it's amazing that we're all coming together and just trying to have this discussion.
If I may say, one thing about Health Canada being a bit slower is that we have the advantage of watching how things go over the next few weeks in the United States.
Mm-hmm.
So that hopefully will go well and it'll offer us some reassurance. Or if it doesn't, then we'll be really happy that we're a bit delayed.
Yeah. So with that, I'll turn it over to Leanne Matlow to conclude this evening.
And I just want to take 1 minute to thank all of you. Tally for incredibly orchestrating this with the questions, getting through them all. Noah, Carly, Julia, and David for really giving a wealth of knowledge to very, very important questions. And I thank Ivan and the entire healthcare division led by Emily as well, who facilitated this discussion. I'm sure people were, as watching the numbers, I'm sure were phoning saying, you have to get on this right now. And to that end, we're going to be able to make this available to people who need to hear these very, very important questions answered. So thank you so much. Remember that UGA can be there for you to answer these questions and be there to support you in many different ways. And thank you for being part and contributing to our community and what we need to. So wear your masks, keep your distance, wash your hands, and get vaccinated when it's your turn. So thank you so much. And everyone have a great night. Thank you.
Thank you.